So welcome everyone. My name is Ushma Patel, Director for Special Projects and Educational Programs at IPFCC. Today's informal conversation is around improving organizational websites to support partnership with patients and families. So as you're joining, I hope you can just fill out our quick poll to see who's in the room today. I'm joined by my colleagues, Bev Johnson, IPFCC President and CEO, as well as Deborah Dawkin, Family Leader and IPFCC Coordinator for Patient and Family Partnerships. Behind the scenes, we also have Marie Abraham, who will be our chat monitor today. I encourage you all to speak up and join the conversation and also use the chat. Folks are still coming in, so feel free to fill out the poll. We have 66% who have completed it so far. Looks like almost half of you are coordinators responsible for implementing patient and family-centered initiatives. We have several patient and family advisors, which is wonderful. There's folks from the patient experience, patient relations department, a couple from diversity, equity, inclusion staff. All right. So I'm going to go ahead and end the poll, just given the time here. You can hopefully see the results here. So yes, so still over half of you are from the patient and family-centered care realm. I see some marketing and communications staff, which is wonderful. One from IT. This is just a wonderful, diverse group of folks today. So we're so happy that you could join us. Right. So I'm going to go on in the interest of time, but if you haven't joined us before, please, we welcome you for the first time here. We're so glad that you could be with us. Please utilize the chat today to put in your name, your organization, and your where you're dialing in from. We will use a combination of polls and just live discussion to learn from you all. And that is truly the goal today, is to hear from everyone and learn from each other. We will have the resources and recordings from the call posted in PFCC Connect. So feel free to, go back to those resources and share them with your colleagues. I'm going to launch another set of polls here in just a second to kind of figure out and get a lay of the land. First, we wanted to find out how many of you are directly involved in contributing content or suggesting changes to your website. And second, we wanted to find out if you believe that your website is easy to use and offers helpful information for patients and families. Our hope is that even if you feel like your website is in great shape, we can all learn from each other and get additional tips to make it even better, to support patients and families, and even involve them in improving these websites if you aren't already doing so. So it looks like 69% have voted so far, so there's still a couple more votes coming in. Looks like a majority of you are involved in contributing content, so that's wonderful. And for the second question, it looks like it's almost split in half. Some of you believe that your website is easy to use and offers great, helpful information. It looks like almost 60% of you are saying no to that question. So hopefully this conversation will be helpful to you all, and we can, brainstorm some ideas of how to improve those websites. All right, so it looks like 75% of you have voted, so I'm going to go ahead and just stop the poll so that we can start our discussion here. Here are the results. So let's go ahead and start our first brainstorming question. I wanted to find out from you all, what makes a good website from the patient and family-centered care perspective? So feel free to chat in and speak up. I see several of you are on video and unmuted, so feel free to raise your hand and chime in here. What do you think makes a good website from a PFCC perspective? Would anyone like to be our guinea pig today?
Our website at St. Joseph's has recently undergone a redesign with patients and family caregivers in mind. So what we aim to do is make the information they want most easily accessible without having to dig to find it.
That's great, Colleen. Could you tell us a little bit more about that?
Before the site was launched, we conducted research and focus groups, and our old website had sort of stories along an upper banner, but really what our patients and caregivers want to know is where's my appointment, how do I get there, where do I park, and what can I expect at my appointment. So we redesigned the content to break it down into those things. Here's our locations, here's how you get there, here's all our areas of care. And we also standardized all the areas of care so that there is consistency from program to program in the information that's available, divided into contacts and services and what to expect, and those sorts of things that are consistent across all the areas of care.
That's wonderful. Others?
Hi, good morning, everyone. So we are an academic health center, and for probably the past 15 or 20 years have really pushed out all of the great scientific things that we're doing at the hospital. And our marketing team is now currently undergoing a redesign of our website to move the content from very heavy research and scientific focused wording to things that connect with patients, and going back to the whys that we're here and what we're offering them, versus all of the great things that we're doing in the scientific realm. And it's something that we've pushed for a very long time, but there's just this connection to being scientific is so important. And yes, absolutely it is, but our average patient wants to know how we're going to help them with their medical need, not how our medical needs are, from an academic lens, being tested and trialed and, published, all of that stuff. So it's been a very interesting dynamic that we've had between what our patients need and what the organization wants to share.
From what organization are you calling from?
UC San Diego Health.
Okay, wonderful.
Just a comment on that. This is Bev. I think you're reflecting what many websites are conveying, particularly from academic medical centers. So it's lovely to hear what you're trying to do in San Diego. Thank you for sharing that.
It looks like Marty Carney has her hand raised.
I do. Thank you, everyone. Good morning. Good afternoon. We had this conversation yesterday, but we have a pretty robust health literacy group at Brigham and Women's Hospital. And we have found that if we take what people are writing or doing, we spent an hour on a call yesterday for a DEI survey using 3 patient advisors, some of our leaders within the Center for Patients and Families, and the clinical leaders. And that really made a difference. And I think if you can use that as a process to start changing things, which we're talking about doing our new website, if you work together on it, I think there are multiple lessons that are shared and learned that can be applied going forward so that you don't have to repeat this. I always say we need to all have bifocal lenses in this process gives us that opportunity. What is it that you want to say? To whom do you want to say it to? And how do we say it under the health literacy guidances? And also, how can some of that be translated? Those are our major guidelines that I would like to share.
That's great, Marty. Thank you for sharing. Anyone else would like to chime in here? I see many of you are putting some ideas into the chat. I'm seeing things like patient-friendly language, something to use on mobile phones. Easy to navigate is a very common element.
I think that we also need to see from our patient and family advisors what they would like to see on the website. You know, what, like when they're coming to the website, what are they coming to look for? And is that easy to get to? Like, for example, you know, learning about how to get a copy of your medical records, but it's not so easy. We used to have a button on our website that you could go directly to that, but kind of determining what they're looking for when they're going to the website and making sure that's communicated in a way that's patient friendly and they can understand.
Excellent point.
This is Dejo, and what we're really started working towards, because our advisors told us that they don't really use the website because they go to the hospital and clinics. So we're trying to connect patient and family education information to the website through QR codes or in patient rooms, active links that will take them there so they can see that we have helpful information for them on the website. So that, and then we have one source of truth so that when we're updating information in one place, everyone is getting that updated information. So we're trying to drive our families that use the hospital and clinics to our website because that's not where they intuitively go. So we're hoping to not only make it more useful, but just more used.
And are you finding a difference so far after implementing the QR codes and driving them back to the website?
You know, I'm not sure yet. I haven't followed up. I was just gone for a few weeks, so I'm not really completely fully re-engaged. But you know, from doing that, we have a lot more areas where we're working to do that. But we do have, like, we can access how many times people are clicking on it and seeing that. So that is one of the things that we'll be tracking.
Wonderful. Okay. Well, we compiled a little list here of some of the elements that we thought would make a good, website from PFCC perspective. And a lot of these points you all have hit on either in the chat or verbally, being easy to read and navigate, considering health literacy. So, what reading level is appropriate to use on the website, making sure that they're accessible in different languages. Seeing patients and families right up there on the homepage and on the search or navigation bar so that they know where to go specifically to find the information that they're looking for. Things like including family presence and visiting information and, making it easy for patients to access resources as well as find out information on, the organization or health system's policy on patient and family-centered care, as well as whether they have active PFACs and what the PFACs are doing. So we're going to move on. Actually, I'm going to turn it over to Deborah next, who's going to walk us through a template that IPFCC put together as part of our Better Together campaign. So Deborah, go ahead and take it away.
Thanks, Ushma. So we wanted to share this, although it's related to the Better Together campaign. It certainly has broader implications for websites. And from the beginning of the Better Together initiative, we really started looking at websites And I think Bev and I now have kind of a fascination with looking at websites and reacting to them. So we put together this template related to Better Together, but wanted to share it with you today. And some of the things we're going to say may seem very obvious to some of you, but honestly, they came out of looking at websites where this is not really present. So this is supposed to be the homepage of a website, General Hospital in the USA. And the red highlighting here is making the point that on the landing page, there should be something that on the search bar that calls out directly to patients and families. And in our exploration of websites, this is indeed not always the case. And that, that it specifically mentions both patients and families. And we highlight the family part because often the patients might be in the search bar, but not families. And they too need to know where to go. Next slide, please. Again, highlighting patients and families. And the first paragraph on this page really calls out that the website should affirm the role of patients and families as members of the care team. And also affirming as a result of that, the concepts of patient and family-centered care. And then on the right hand or the left-hand side, highlighting the importance of having some kind of menu with key categories of information that would be of interest to patients and families, and therefore easy for them to find and access. Next slide. This page of the fictional website, you see on the left-hand side with the menu highlights care partners. Family members are care partners, and really provides some basic information about what their role is and how they really contribute to the healthcare team. And again, this is adapted from some of our Better Together materials, but we think it has broader implications in terms of a hospital or healthcare website. And next slide. And finally, this page of our fictional website calls out something that we think is so important, related to language, but related to just the underpinning of patient and family-centered care. And that is that there is a distinction between family members and visitors. That there are indeed people who are visitors and they can play a role, but it is a role that is very different from that of family members or care partners. And as a result of that, that there's a difference between family presence and visitation. And you all know that those words get conflated and equated all the time. And we're really urging on your websites that you make a clear distinction. So that was a quick glimpse into something that you might want to look at as a tool and share with others at your organization. And let's go on to the next slide. So we already, in your response to the first question, we heard some examples of changes that a couple of organizations have already made to improve websites from a PFCC perspective. But we're wondering whether any other people want to chime in about things that they've actually done or things that they think could be done to their websites to improve them. And I do want to call out, Lisa Allen, I know you're on this informal conversation, and in your registration, you had a question about sharing the results of patient experience surveys. And I wonder whether you want to say a little more about that. Is that something you're thinking of doing to improve your website?
So thanks, Deborah. I think that for us at Johns Hopkins, we have a quality and safety, the Armstrong Institute. And we're redesigning that website. So this is really good timing. We have a different piece, which is all about visiting and your role in COVID. The whole patient and family piece. But this is around quality metrics. And our question is, who's going to come there and what do they want to see? And so I guess my question is we have been showing our HCAHPS scores. Do people think patients care about seeing those, or are they going to other sites? Have people invested in displaying that? So that was my question to the group.
We encourage anyone else, if you have thoughts to share with Lisa, or how you do it in your organization on the website. And just feel free to speak up, as well as using the chat, but it will be more of a conversation if we actually hear some voices. Anyone have any comments for Lisa?
Deborah, while people are chatting in or wanting to raise their hand or speaking out, this is Bev again. And I was so thrilled to see your question, Lisa, because one of my favorite websites at an academic medical center had at the top of the homepage quality reports. You didn't have to dig around. It was right there. And I was looking at it, from my PFCC hat, but also as a patient. And I could go there, and they picked not every specialty, but they combined so you could see their experience and safety records, and the experience, not again, a zillion questions, but a couple that would give you an idea of what it might be like to be cared for in the cardiology department or the OB department. And I found it useful. I will share with you one reason I was looking at it was when I've served for years on the Quest for Quality prize. And we were looking for, how does the public, particularly patients and families, know about the quality of care? And I think patient experience fits there, but it needs easy access and useful information.
Thank you, Bev.
And Lisa, I see a couple people responded in the chat with different points of view. One, that they used to share the results on the website, but found that there were not many hits. And someone else affirming that people do look at those reviews. So
yeah, and we've been very successful in our Find a Doctor, where we post comments and star ratings from our outpatient survey, the medical practice CGCAP survey. And we've definitely found that has increased views on the site and the time spent on the site. So I think that piece, it's, do people, do we go to Hospital Compare? And that's really where people are looking for their HCAP scores, or is it something we're more interested in and our patients really just want to read some comments? Bev, you're a unique case from your background, I think. So interested.
Okay, thank you, everyone. Just again, is anyone else willing to share some changes that you might have made recently to improve your website, or a change that you're really seriously thinking about making? And if not, we will move on, but we want to make sure you have an opportunity to share anything that you're doing. Okay, I think we're going to move on then, Bev, and I'll turn it over to you.
Great. Thanks, Deborah. And feel free to chime in either through the chat or speak up as I share some examples. This, as Deborah shared before, this has been almost a pet peeve of ours, that we just don't think that websites are designed in a way that's truly useful for patients and families. And we recognize there are several audiences. We view the website as your public interface, and that patients and families are a key audience. Health professionals and staff are another. Trainees may be another for some of you. And I think people applying for a job. And I've always thought that, wouldn't it be great if it was very clear before anybody applied that you're committed to patient and family-centered care? They see it front and center, and that you attract people and maybe rule out people in your workforce. So that's where my thinking has come from over the years. Next. So I'm going to share you some examples of what intrigued us and what we liked about them for different kinds of organizations and how they evolved. I thought it would be good to have in our mix of looking at websites, primary care, because I think sometimes this is a primary care clinic in the community in Colorado. And I just like the tone of the opening page. Welcome to Westminster Medical Clinic. Next slide. And this website was developed very much in partnership with their Patient and Family Advisory Council at this primary clinic. And it's easy to find who are the people in the clinic and a little bit what they're like. So there's a video that I'm not going to show you today, less than 2 minutes. And it's almost everybody who works in the clinic. So it leads off with the lead physician, but it's the medical assistants, the office manager, other doctors, all under 2 minutes. And it takes you on a little tour of the of the clinic. And then there is a clinic newsletter promoting health and activities of the practice. This practice is working on issues of social isolation and loneliness even before the pandemic. And you can get a primary care newsletter, sign up for it if you want. So I thought it had useful information. Next one. So I just stumbled on this website in looking at what we wanted to share for today. And yesterday I had an amazing conversation with the acting person in the position as acting marketing and communications director. I wanted to know how this website was created and how they had involved patients and families. So this is Nationwide Children's Hospital in Ohio. Sorry. And if you look at that top bar, every single one of those are from the patient and family perspective. Find a doctor, conditions we treat, specialties, locations, your visit, family resources, and education. But to deal with their other audiences, look above, but they recognize patients and families are the primary audience. And then for medical professionals, quality research, giving, and careers. So again, they reach all the audiences, but I was thrilled with that focus in that bar. And so let's go to family resources. Next slide. And this is like a tile format, a little bit like that navigation bar that Deborah showed on the side, but you can get to all the key things on one page. My tolerance on looking at websites, I don't like to have to dig around a lot. And I felt that this was easy and you could find different things. So let's go to the next slide. This is a brief slide on family-centered care, and it's really emphasizing the role of families, that it's important for their website. And let's and then let's go to the next slide. And I want to tell you a little bit about marketing's role in this. The marketing person I talked to yesterday said that part of her assignment was to work with the chief nursing officer. So often that is true, and they're working on internal communications as well as external communications. And the chief nurse, as in many hospitals, also has the title over patient care services. And so that's a broader responsibility than just nursing care. And with that, the chief nurse was very involved with the Family Advisory Council. And the marketing person said, I was given the quote, client assignment to think of the Family Advisory Council as my client to help them on marketing and communication issues. And it started first with how could I be helpful through my department in letting other people in the organization know about what the Family Advisory Council was doing and that they were a resource. But then 5 or 6 years ago, there was an opportunity to redesign the website. And when that happens, you bring in the web design team. So there are two different functions and skill sets. And so that web design team met a lot with the Family Advisory Council. And that's how that bar across the top was created. They had to build that structure. But content comes from marketing and communication. And what she did was, and the tip she has for all of you, is that working with the Family Advisory Council or patient and family advisors, marketing can help provide the web team with polished content, making it easy for them to integrate it into the website. So she developed this content that talks about the different advisory council roles and family faculty. And then if you go deeper, you can see a lot of more detail about the main Family Advisory Council. But I thought another thing that was interesting is on family faculty through marketing and communication, it's on the hospital's intranet. So one of my questions to her, is there a place for PFCC in your intranet, which is all internal? And she said, yes. And it's very important that our family faculty be there. It's aligned with stories from our family faculty so that department heads and faculty can reach out to involve them in a class or a meeting. That's how they populate the really information about family faculty. So I think there is great collaboration between the web design team, the marketing and communication, and family advisors. And the marketing people were assigned to serve on the executive committee for the PFAC, which involved PFAC leaders and a couple of staff and marketing. So that's how this evolved. Any thoughts or comments of that? Maybe there may be messages in the chat, but oh, good. You're letting people see more of it. Then next slide, please. I'm delighted that Ann Bannerman from Moffitt cancer center in Florida, could join us today and talk a little bit about the evolution of their website. It was another one that intrigued me and had some wonderful features. Anne, are you there? I saw you earlier.
I am. I'm here.
Okay, there you are. You want to tell a little bit about how some of this came about? I think it's intriguing.
Oh, sure. I think we're soon to be updating this website too, like a whole new platform. So, but we have, fortunately, we have a really strong relationship with marketing and PFAC. So they really, really like partnering with our patient and family advisors. So they're always involved in the development. And you know, I think having that patient and family section is really helpful. One thing that always catches my eye on this page is that training and education tab at the top in the blue bar. Even I remember a PFAC meeting where one of our patient advisors said, it used to say education and that's it. And she would be clicking on it, hoping to find patient education, and it was nowhere to be found. It's really more, you know, a training tab. And so, you know, we always have issues that we follow up on after the PFAC meetings, and my job was to get this done. And I tell you, it took me 9 months to get that changed to training and education. So even though we have a strong partnership, it doesn't mean it's always perfect or easy. You know, but finally I got the right leader to communicate with the right leader, and that wasn't too hard to do. But it's just this is such a big source of information that you're never done. It can always be improved. And I'm working on it right now to improve the landing page for a patient family advisory program to be attracting more diverse advisors, and to include videos, and to be easy to use on a mobile phone, and leadership messages about why it's important to have the voice of patients from underrepresented backgrounds included. So that's a real area of opportunity for Moffitt, and something I'm working a lot with our marketing team to improve that section of this website.
That's really wonderful. I think probably everybody on this call, and we've certainly seen that a need for patient and family advisory programs to increase the diversity and representativeness. So it's great to see that you're building that in to the website. This one also, you have it so that can be translated into Spanish with a single click.
Yes, that's right.
I know that I saw some others that, you know, would go into Arabic or other, given whatever population that you're serving. So let's go to a next slide with this. What caught my eye was, again, one place where you could find lots of things that were relevant to patients and families. Anything else that you want to say about this particular page?
I guess just one of the more recent changes that we've made was to include more for caregivers, and to have a tab that was feedback directly from our patient and family advisors, to have a tab for caregivers and more information for them, which I thought was excellent. And I think too, I mean, one of it may be not related to this page so much, but another idea that came from our advisors in a recent council meeting was to have kind of on Moffitt.org right in the beginning at the front landing page, some type of welcoming message saying, that all are welcome, and, to have right up front, making sure that people from all backgrounds and ethnicities and will feel welcome and included at Moffitt. And marketing was super receptive to that, and they loved the idea, and they're working on it now. So I'm excited to see what they come up with, but both in our physical presence and on our web presence, we are working on making that happen.
That's great. I think you have some interesting thoughts on the next slide.
Okay, so this is a near and dear to my heart. This is our patient and family orientation. We offer it now virtually Monday through Friday at 2 o'clock. And it's a 30-minute presentation where patients and caregivers from anywhere in the world can join and learn about the background of Moffitt, how to find their way around, and information about all the different supportive services that are available here. And this was an idea from PFAC years and years ago. And what I love about it now is that we actually have patient advisors giving the presentations. And that is just an added benefit to be able to connect with someone who's faced something similar. So it's a wonderful program. And then they receive a messenger bag with organizational files and resources to help them get connected to the supportive services. And the feedback from those sessions is phenomenal. So, we used to do it in person, but still with COVID, we're still doing it virtually only right now.
And, it's, I guess maybe a benefit of the pandemic, because I remember being at Moffitt and seeing that orientation. And it was just an amazing, supportive first impression. It helped everyone and so beautifully done. And then the fact that people can tap into this from all over the world and probably listen a couple of times if they need to, is
Yeah.
great. So,
First time we did it virtually was with a family that had siblings in 3 different countries. And we thought, no, this is nice. This is a benefit of doing it virtually that we never thought of. So it's definitely a silver lining.
that's great.
And luckily, when new patients register at Moffitt, right now it's one of the steps. It's not mandatory, but it's the 5th step in a process. And so that really helps increase the attendance, which we're thrilled about.
Terrific. Let's, at the bottom, we highlighted that you can click directly on Spanish materials as well. And that link was in that patient and family orientation, even in
Yeah, and the session is offered in Spanish as well.
Oh, great. Let's go to the next. So this is a community hospital. We wanted to show all different kinds of hospitals. And this is Luminous Health and Anne Arundel Medical Center in Annapolis, Maryland. And they have a section with patient resources, and Ushma's highlighted, after your visit, before your visit, during your visit, for information, other practical information they provide as well. And then there's a tab on that navigation bar on the side for patient and family advisors. Next. And there again, several of you have talked about wanting to use this as another recruiting device and to have information up on the website. And so they are sharing a little bit about the patient advisory program, the kinds of things they do. And they are nicely saying that they're pinwheel sponsors of IPFCC. Next slide. This is Cohen Children's Hospital Medical Center in New York, part of the Northwell Health System. And when Deborah and I were first working on the Better Together campaign, a pet peeve would be no website would ever say anything but patients and visitors. It just seemed like no one could write the words families up there. And then they said, oh, well, there's not enough space to say patients, families, and visitors. And we just hit brick wall after brick wall about it. But here's a place that managed. I think you can say that. And it helps people learn about the differences between families or designated care partners and visitors. So next slide for Cohen. And again, they made it easy planning your visit, and right up front, it's about your stay, your role as a care partner, because we really think we've got to educate people about what that role is, and then also preparing your child for this children's hospital. So another slide now. And we also were impressed that, you know, while you're here, they highlighted what is a key aspect of patient and family-centered care, which is family-centered rounds. And I think the general public, for the most part, don't understand that, oh my goodness, we can participate in rounds. It is about our care, and having a care partner participate is really a safety strategy. So they're explaining what it is in that preparation part for families on the website. Next slide. So those are the examples I have. You all may have other pearls to share or push back and say, I didn't like this, or I would change that. But to think about, you know, are there other ways that you think you might connect with marketing or the website design people, or with getting them together with your patient and family advisors? One thing that Anne said, and I think the word persistence is really important here. Deborah and I worked on a project in New York State, and it was very difficult to get changes on the websites, particularly in health systems. We couldn't figure out who was a leader who could make that decision. And even when they weren't structural changes, just a word change was difficult. So 9 months, you hung in there and got that change. So I think that is important. Other thoughts?
I think inviting the marketing teams, like leaders, to come to PFAC meetings and present about their marketing campaign, you know, about their vision for Moffitt.org, and, you know, helps, because they then can see the advisors in person and or virtually, depending, but and can see their valuable comments firsthand, and hear, I should say, hear their valuable comments and questions firsthand. And it could make them more comfortable wanting to partner with the advisors offline, you know, in at other committee meeting levels. So I think inviting them to come, you know, at least once a year to present can help.
You know, that's a great suggestion. And I remember years ago in Oregon, they were redesigning the website for patients. And the web team came to meet with the advisors, and they literally worked on the advisor together. What would it be like if I needed to find information? And one of the things, part of it was the design of the portal, but they figured out they had to make 7 clicks to get to a medication list template. And they said, you know, we're just not going to hang in there for 7 clicks. So the designers all felt we got it in there, but the advisors helped them see the difference. It looks like others have had this same experience about persistence.
Beth, I had a question, both for Anne and for others, that Anne, you mentioned having marketing come at least annually, but are they actually members of the PFAC? Or
They're
have a
no,
slot?
they're not. We
Okay.
don't have anybody from marketing on the PFAC. We have only very high level leadership on our council.
Okay. Does anyone actually have marketing represented on as a staff component of their PFAC?
We do at Johns Hopkins. We have rotating marketing folks that sit on the PFAC meetings.
That's an interesting concept, that rotating, that would be educating a whole number of people who have different roles probably, and might be more manageable.
Yeah, they really enjoy it, and they're very helpful for us.
I think that would inform all aspects of their work. I see an interesting question from Donna in the chat about having to present a cost benefit analysis I'm about, now this could be structural change. I think some of the changes are not very costly. There certainly is a lot of time and effort when you're making cultural changes, I mean, structural changes. But others, have you had to justify? I think everybody's looking at how can we improve the patient and family experience.
We have our marketing team is stretched very thin at Stanford Children's Health. So what we try to do is team with them and send what we would like to see on there. We try to prepare the text, and we have someone on our team who works on the internal internet. And so she helps prepare what changes we'd love to see on the external internet. And then we have absolutely no say over when that happens, but they definitely use our suggestions when they do get around to updating things.
That's a great way to try to do it. I do think it's very difficult, the timing, and that's why we were talking so much about persistence, but great to have another connection to, these are the changes we'd like to see, or the additions. Other thoughts about websites? I'm trying to keep up with all the chat here.
This is Mary Lynn Knighton from St. Francis Medical Center, lead PFA in Linwood, California. And I really liked that idea that you could change the language with the click of a button. So I'd like to hear a little bit more about how that was created and what sort of technology might be needed. And I believe it was the Moffitt speaker who told us that.
Change the language with the click of a button.
At the beginning, in different Spanish or Arabic or.
Oh, that.
Yeah.
Yes, I mean, you just click and then the whole thing's in Spanish. I don't think every single page is translated, but I know my section was, and many sections are. So
that may be, I don't remember, Ushma, we put some resources at the end about literacy level. Whether that's included, that mechanism.
Yeah, it may be in there, but I have a feeling that may be something that you have to work with your back end website people, like whoever's designing your organization website. So that may be a question for them. I did have a question for Anne. Do you have multiple languages, or is it currently just Spanish?
Just Spanish. We try very hard that everything we have is available in English and Spanish, and it's really kind of a mandate at Moffitt. And so it's not hard to get things translated, everything is translated. And then we can, for interactions in person, we have the ability to connect to any language through a service.
Great, go ahead about that, Anna, didn't mean.
Okay. So like we probably have 12 people in our language services department, and they represent maybe, 5 different languages they probably speak, but we have a service where you call in and they will translate through the phone. If it's a different language than we can do in person on site. And we've even done that for the orientation too, which is usually only for clinical care, but in certain situations, we can get exceptions and use that service, which is awesome.
I will, I'm not sure, but you might look around in Michigan. I think the Beaumont system used to translate everything into Arabic. I'll try to figure out if there's a way we could get back to you on, and you may be able to just Google how can, websites be translated into multiple languages. But once you have that, it then happens. A lot of places don't translate all the pages, but many do. But that's a great question. And I think if with the diversity of populations we all serve, that's a good thing to think about. So and I don't know, certainly it's automatic, and for all of our Canadian friends on the call today, everything is in English and French, right? So you all might be a resource for that information. So I think I'm going to turn it back to you, Ushma, unless there are other questions or comments. This chat is amazing.
I
So
know, wonderful.
we will save all the chat, and that will come with the recording, right?
Yep, exactly. So let me just share some resources. Here are the links to the Better Together website template that Deborah presented in the beginning. There's 2 tools on health literacy that we found very, very useful. First is the resource from the Agency for Healthcare Research and Quality. And the second website is from CDC. And the ARC tool specifically walks you through all the steps of building a website and making it a simple website for users. So it has steps on how to write text, how to display, how to organize the content. So definitely check those out. I think Marie already put those links in the chat. So thank you, Marie. Next steps for our conversation, we will post the recording, the chat, the slides, everything up on PFCC Connect. So stay tuned for a follow-up email to go out with those links. And you can also log into the forum and find the files on your own. We do encourage you to fill out our short survey. So I'm going to include a link to that as well in the chat. Just very short through SurveyMonkey so we can get some ideas on future topics. We are running on a kind of an every other month schedule, so we'll reconvene in July. So hope to see you there. And finally, we're very excited to share that IPFCC is celebrating 30 years. So, since we began its mission to advance patient and family-centered care, we're very excited to be celebrating all year long. You may have seen this in our newsletter, but we did announce the IPFCC Partnership Award. So feel free to nominate your team or another team that you know of in your organization. You can find further details on our website under Best Practices and Partnership Award. So that nomination process is already open and we encourage you to apply. And then stay tuned for a virtual celebration event in the fall. More details to come. So if you're not already signed up for our newsletter, please do sign up and make sure that you're getting all of our emails. All right, thank you so much for joining us. Here's the link to the survey and hope you all take care. This was such a great discussion today and thank you so much for your participation. Have a great day. Bye-bye.